Hi everyone, I'm Stephanie Tuis, Care Coordinator and Fall Prevention Specialist with Kindle at Home. Also, I'm a Certified Occupational Therapy Assistant. I'm so excited to present to you for Fall Prevention Awareness Week 2022. I will be helping you to prepare your Falls Prevention Toolkit, a resource to help you be proactive in fall prevention and pack your toolkit with all the necessary tools to keep you on your feet. We will be touching base about what puts you at risk for falls, what assessments or screens you could be doing to check on your personal risk, how to recover from a fall, exercises you can do every day to strengthen your legs and improve your balance, and lastly, how to prepare for a fall and what to do to have a plan in place for if a fall does occur. I look forward to sharing all of these topics with you in the coming weeks, so thank you so much for joining me. Our first tool for your falls toolkit is fall risk. What really puts you at risk for falls? There are a total of 7 different etiologies of falls. Those are medical related, mobility related, sensory, psychological, medication, environmental, and behavioral. These 7 different etiologies filter down into 2 smaller categories, intrinsic and extrinsic factors. Intrinsic factors are those that are coming from your own body naturally. Those include your age, previous falls, muscle weakness, cognitive function, poor vision, chronic conditions like diabetes, Parkinson's disease, postural hypotension, which is a drop in blood pressure when you stand up from a seated surface, and fear of falling. Extrinsic factors are those that are coming to us from the outside world. You can see that those include poor stair design, dim lighting, obstacles in the home, uneven surfaces, improper use of assistive devices like canes or walkers, lack of grab bars in the home, and psychoactive drugs. Within these 2 risk factors, you will find modifiable and non-modifiable risk factors. Non-modifiable includes things like your age, chronic conditions like Parkinson's disease, or even having a previous fall. These are things that you just cannot change. Modifiable risk factors are those things in your own world that you can change to decrease your risk of falls. These include things such as working on your gait and balance, impairments with a specialist like physical therapy or occupational therapy, medication reviews with your doctor, making sure that they know that there may be a medication causing you to become dizzy or more fatigued. Even a fear of falling is something that you can modify. Don't be afraid to use your community resources to help you prevent falls. Your second tool for your falls toolkit are fall risk assessments or screens. These assessments have been proven by the CDC's STEADY initiative, which stands for Stopping Elderly Accidents, Deaths, and Injuries. These tools can be used on your own, with your family and friends, or in congruence with your healthcare provider to help reduce the fall risk amongst older adults. These assessments include the timed up and go, 30-second chair stand, and 4-stage balance, each of which we will be addressing here today. It is important to note that before initiating these fall risk assessments, you should first use the fall risk screening tool seen here. This fall risk screen is a 12-question tool that will show you if you may be at risk for falling. As you can see here, each yes is weighted by points. Let's review the questions now. I have fallen in the past year. Why might this matter? People who have fallen once are likely to fall again. I use or have been advised to use a cane or a walker to get around safely. People who have been advised to use a cane or a walker may already be more at risk for falls. Sometimes I feel unsteady when I'm walking. Unsteadiness or needing support while walking are signs of poor balance. I steady myself by holding onto furniture when walking at home. This is also a sign of poor balance. I am worried about falling. People who are worried about falling are more likely to fall. I need to push with my hands to stand up from a chair. This is a sign of weak leg muscles, a major reason for falling. I have some trouble stepping up onto a curb. This is also a sign of weak leg muscles. I often have to rush to the toilet. Rushing to the bathroom, especially at night, increases your chance of falling. I have lost some feeling in my feet. Numbness in your feet can cause stumbles and lead to falls. I take medicine that sometimes makes me feel lightheaded or more tired than usual. Side effects from medicines can sometimes increase your chance of falling. This is an important time to say if you feel like any of your medications are causing you to be dizzy, lightheaded, more tired than usual, please call your doctor right away and let them know. I take medicine to help me sleep or improve my mood. These medicines can sometimes increase your chance of falling. I often feel sad or depressed. Symptoms of depression, such as not feeling well or feeling slowed down, are linked to falls. Now you will add up the number of points for each yes, 2, 3, 4. And note that if you scored 4 points or more, you may be at a higher risk for fall. It is important to note that regardless of the score, if you have fallen in the past year, you are more likely to fall again. However, a total score of 4 or more puts you at risk for falls. If you score a 4 or above, or have had a fall in the past year, you are encouraged to jump into the 3 assessments we chatted about earlier. Those are the tug, the 30-second chair stand, and the 4-stage balance. Even if you have not had a fall in the past, or if you did not score higher than a 4, I encourage you to discuss falls with your doctor to prevent future risks. Being proactive is key to preventing falls. Your doctor could recommend further testing for fall prevention, such as bone strengthening assessments, heart testing, medication reviews, podiatrist or optometrist referrals, community exercise, fall prevention programs like stepping on, physical therapy assessments, and even home safety evaluations. Okay, so here we're going to watch a video of the Timed Up and Go assessment, or the TUG, T-U-G. This is to assess mobility, and all you will need truly is a stopwatch, but for myself, I like to have painter's tape so that I can clearly mark off the distance that the person I'm assessing will go to, and they have a clear visualization of that, and also a measurement tool to measure out that 10 feet distance accurately. You'll want a chair that the person you're assessing or yourself can sit in. And if you have a chair with armrests, I would use that as well in case the person needs to be able to push up. If you have a walking aid like a cane or a walker, I would encourage you to use that during this assessment. And then you'll need to stand up 10 feet, walk the distance, and walk back. Also encourage the person who is doing the assessment to walk at their normal pace. This is not something that they want to rush through or run through because that puts them at more risk for a fall. So you want to record the time that they do this in, and any adult that takes greater than 12 seconds to complete this TUG assessment is at risk for falling. So let's take a look at the video. As you see, they stand up, they walk the 10 feet distance, turn slowly, walk back to the chair, and sit down. So all the time that they are taking to stand up, walk the distance, walk back and sit, you have the stopwatch. And again, if it takes them longer than 12 seconds, they are at risk for fall. All right, let's take a look at the 30-second chair stand assessment now. This is to test your leg strength and your endurance. You're going to need a stopwatch and a chair with a good sturdy back. The chair can have armrests, but you are not to use them during the assessment. You'll be crossing your hands over your chest to not utilize your hands to push up. If you do need your hands to push up, then this assessment is null and void. It does not work, and it is going to show you that you probably likely are at a risk for falls. So what you'll do is you'll start your time, and for those 30 seconds, you're going to try to do as many sit to stands from the chair as you can, and that number of reps will correlate to a score based on your age. So for instance, a man between the ages of 60 and 64 should be able to do 14 or more sit to stand reps, and a woman between the ages of the 60 and 64 should be able to do 12 or more of those reps. As we age, that number goes down. So a male between the ages of 90 and 94 should be able to do 7 or more of the sit to stands. And a woman of the same age between 90 and 94 should be able to do 4 or more of those reps. So let's take a look at the video. Here you see he's crossing his arms over his chest and starting to stand. You want to be on the lookout for becoming very fatigued throughout this, maybe having to stop and take a rest between going up again. You also want to take a look at if they're unable to push up at all. If they say, I can't do this without pushing up from an armrest, then that means that they likely are at risk for falls. And there we go. That's the 30-second chair stand. Okay, so here is the last assessment. It's called the 4-stage balance, and this is going to test your balance in 4 different stances. You'll need a stopwatch for this, and you'll be able to tell your person that you're doing the assessment on or yourself that you can have your arms out to kind of reposition yourself, re-guide yourself back to a normal balanced position throughout. That's okay. You'll stand for 10 seconds in each position. And you'll want to go through each one in order. So the first one is just a normal side-by-side stance. The second is called the instep, and it's where your feet will be somewhat staggered. You'll take the toes of one foot and bring them to the instep, the middle of the other. And the third is tandem. And it's important to note that if you can't do the tandem, this is where you would know that a fall risk is present. So you'll bring the heels of one foot to the toes of the other and try to maintain that stance for 10 seconds. And the last one is standing on one foot. If throughout the assessment, one of the balance exams are failed, so say you do the side-by-side and they pass that one and you go to the instep one and they can't do that one, you would not move on to the next balance. You would end the assessment there and say that they are likely at a risk for falls. So let's take a look at the video. So here he is doing the normal side-by-side stance. He's going to stand there for 10 seconds, and then you'll say stop when you reach the 10 seconds and go back to a normal standing stance. Now he's moving into the instep where you bring that heel to the middle of one foot or the toes to the middle of the other. Stand for 10 seconds, stop, and move out to a regular resting stance. Now this is the tandem where you bring toes to heel. And this again is the one that if they have a loss of balance here, you are at a risk for falls. Back to a normal stance. And now you're going to stand on one foot. And whoops, he stepped out of his one foot stance there. And it's important to say, if you do step out of that 1 foot stand, you have to end it there. He can't continue to go through the 10 seconds, even though he came back up. You would end it there, and you would say he could not do the 1 foot stand. And that's the 4-stage balance assessment. Your third tool for your falls toolkit is fall recovery. Knowing what to do if you do experience a fall. Falling is scary, but being prepared for a fall and knowing what to do if a fall does occur will help decrease your fear of falling, therefore decreasing your risk of fall. Let's check out some videos on how you can recover from a fall. Your first step is going to be checking for injury, moving all of your extremities and making sure that you feel no pain. If you do, stop moving immediately, no matter how small or big the pain is. At this point, if you feel any pain at all, you could be causing more injury than good if you continue to move and try to get up. The second step is going to be to go ahead and push up using your forearms and your hands if you can stand up from this position, if you're strong enough and you have no pain. The third step, if you cannot stand up from that on your back position, is to roll onto your front. So you'll want to try to roll to your left or right. If you're weak on that side and need to pull the arm under to roll over it, do so now. And now you can elevate onto all fours, preparing yourself to stand. After you're on all fours, you can now crawl to an elevated surface to help you push up to that standing position. Once you have stood up, make sure you check for any dizziness. If you have any pain at this point, go ahead and sit down and call 911. The biggest takeaway from this slide is if you are experiencing any pain at all at any of these steps, stop and do not move any longer. If your phone is within reach, go ahead and grab it, call 911. If you've got an Apple Watch, you could call 911 through that. If you know someone is in the home with you, yell out, say, "I need help, please call 911, I'm in pain, I've fallen." And, if your phone has that voice capability, you could always yell out, "Siri, call 911. The fourth tool in your fall prevention toolkit is fall prevention exercises. These exercises help reduce the chance of falls. When you do these exercises, you can improve your balance and your muscle strength, both of which are used to prevent falls. We will start with balance exercises that should be done every day. Then we will move on to strengthening exercises, which should be done every other day. These exercises do not need to be done all at the same time. You can take breaks from them and break them up into different parts of the day. Do what works for you. Here are some exercise tips for the exercises we're about to watch. Look straight ahead while doing any standing and walking exercises. You can even stare at a focal point on the wall, which will help with your balance. Use slow and steady movements. Do not hold your breath. Count through the reps if it helps you to breathe. Listen to your body. You will have days where you can do more and the next day where you do less, and that's okay. All right, here is your first balance exercise. It's called the sit to stand. What you're going to want to do is sit on a chair that's not too low, scoot to the edge of the chair so there is space between the back of your knees and the chair. Place your feet shoulder width apart and tuck them under your knees. Lean forward, nose over toes, and push off the armrests if armrests are present with both hands. Stand up very slowly, stand tall, and hold for 5 seconds. 3, 2, 1. Now sit slowly, do not plop, and repeat this exercise 5 times daily. Here is the second balance exercise. What you're going to want to do is stand up tall and look straight ahead, face a counter or table if needed. Place your hands on your hips. If you cannot hold your hips, that's okay. Try holding onto a kitchen counter or a table. Take a side step to the right with your right leg. Then close the left leg so you're standing with your feet shoulder width apart, toes pointed forward. Repeat this movement to complete 10 steps to the right and 10 steps to the left. Okay, so if you want to advance this exercise, you could try taking longer steps to each side. So maybe when you first start doing this exercise, you can only take a short distance out. So you just want to lengthen the step width that you take stepping out with that right leg and bringing the left in. You can also gradually increase the number of times that you take those 10 steps to each side. So maybe when you first start this exercise, you're only doing it 1 time a day. You could gradually increase that until you're doing those 5 times a day to each side. Check out this video to see how else you could increase your advancement. So what you can do is increase the height that you are bringing your leg up. You can pretend that you're stepping over an object, and this is great for balance as you're on one leg for a longer period of time. Do you see how he's kind of standing on one leg for longer? Now you know how to do a sideways walking exercise. Here's your next balance exercise. It's called heel to toe standing. What you'll want to do is start with your feet slightly apart, and you can hold on to a counter or a table as needed. You'll move one foot directly in front of the other so that the heel of one foot is touching the toes of the other. You'll hold this standing position for 10 seconds. And if you need to widen your base of support by moving that front foot out just a little to the side, that's okay. The goal of this exercise is to be able to stand steady for 10 seconds while lightly holding the counter or table. Change that standing position next by taking that back foot and placing it directly in front of the other. You'll hold this position now for 5 seconds. And there's your heel to toe standing. Here is the last balance exercise. It's called heel to toe walking. And what you're going to do is stand up tall beside the counter or tabletop, chair or dresser. Look straight ahead. Hold on to the surface with one hand. While looking straight ahead, walk forward by placing one foot directly in front of the other like you're walking on a tightrope. The heel of the front foot should be close to or touching the toes of the back foot. You're going to tandem walk for 5 to 10 steps like this. Pause, then take 5 to 10 more steps forward. When you're ready to advance this exercise, you can do all the same advancements that you did in heel to toe. That's either toe or fingertip touching onto the surface or hovering on the surface. Now you know how to do heel to toe walking. Here is the first strengthening exercise. Again, strengthening exercises are to be done every other day, not daily. So this is the side hip strengthening exercise. You're going to stand up tall with left side towards the counter. Look straight ahead and hold on with your left hand. Keep the right leg straight and the foot straight forward. Do not point your toes like a ballerina. Lift the right leg out to the side, keeping it straight until your foot is about 1 to 2 inches off the floor. Keep your back straight. Do not lean forward, backward, or sideways. Lower your leg to the floor slowly. Repeat 5 times for the right leg. Turn around and repeat 5 times on the left leg. Strengthening your muscles is so important for keeping your bones and muscles that are needed for walking healthily and to help you be independent in your daily activities. With all strength exercises, you can try adding ankle weights and starting with light pounds like 1 and leading into heavy. You can gradually increase your reps. So here he was doing 5. You can increase to 10 and eventually to 15 and to 20 and so on. If you've introduced an ankle weight, once 10 reps becomes too easy at the lightest weight, increase that weight by 1 and start back at the 5 reps until you can reach 10 again, 15 again, 20 again, and keep on this track, gradually adding weight until you're doing the 10, 15, 20 reps at the highest weight for your ankle weights. Do not jump straight to the highest possible weight and rep. Do this gradually. Now you know how to do a side hip strengthening exercise. Here is the knee strengthening exercise. Again, strengthening exercises are done every other day. You're going to sit on a chair with your back well supported, straighten the right leg slowly, hold for 5 seconds, and then lower the leg slowly. Repeat this 5 times for the right leg, and then continue on doing the same with the left. In order to advance this exercise, you would do all the same things that you did for the hip strengthening exercise. And now you know how to do knee strengthening exercises. This is the third strengthening exercise called heel raises. What you're going to do is stand up tall, facing the counter and looking straight ahead. Hold on with one hand. Place your feet shoulder width apart. Come up onto your toes slowly, counting to 5 as you're rising and without rocking forward. Then you're going to slowly lower your heels to the ground, counting to 5 as you're coming down without rocking backward. Repeat this 5 times. In order to advance this exercise, you can gradually increase the reps to 10, then to 20, and so on. Use just your fingertips to touch the stable surface instead of gripping onto the surface. And lastly, you can try to advance by hovering your hands over the surface instead of using that fingertip grip. Now you can do the heel rise exercise. Your next exercise is toe raises, and this is where you're going to stand up tall facing the counter and look straight ahead. You'll hold on with one hand, place your feet shoulder width apart, and then you'll slowly lift up the toes of both feet without rocking backwards so your weight is on your heel. You'll slowly lower your toes back to the ground and then repeat this exercise 5 times daily. To advance this exercise, you'll follow all the same advancements from the last slide for heel raises that you do for these toe raises. The last tool for your falls prevention toolkit is having a fall plan. One crucial point to fall prevention is being proactive, and that means having a plan. Much like kids learn to make fire escape plans, I encourage you to have a plan in place for if a fall does occur. Having an emergency alert device, especially for those living at home alone, can provide security, safety, comfort, and peace of mind. Many of these devices now can alert as soon as a fall occurs and not have to wait for a button to be pressed. This is especially important in situations where one may become unconscious. These alert systems allow for the company to have an emergency contact in order to be able to alert your friends and family when an emergency have occurred. They then call your first responder and even have a place for special instructions, which leads me to my next point. How will a first responder get into your home? The truth is, if a first responder does not have instructions on how to get into the home, they will break down your door to respond to the emergency. And then you have another problem on your hands. If you already have an emergency alert device, I would encourage you to call the company and have them make a special note of where an emergency key is located for first responders. They could even put in your garage code or front door code if you have a keyless door lock entry. If you do not have an emergency alert device, you could and should call your local fire department and ask if they have a system to keep this information on file as well. The last thing you want to worry about after experiencing a fall is having to find someone to fix your broken door. Next, start visiting and touring your local rehabilitation centers. The reality is that 1 out of every 5 falls results in injury like broken bones or head injury, which means you will most likely need some form of physical rehabilitation. Being proactive and knowing which centers are at least in your top 3 will help you be educated on your options, have some control in your plan of care, and prevent you from ending up in a center that you do not have any knowledge about. Last, let's prepare a go bag. Much like a bag that is prepared when waiting for the arrival of a new baby, prepping for an emergency will help you be prepared for having to leave your home. This is especially helpful for those living at home alone and experiencing frequent falls. Within this bag, you'll want to pack 1 or 2 comfortable outfits. Think sweatpants and t-shirts to avoid only having access to hospital gowns. Next, you'll want to have a list of your emergency contacts or who you would want to be called to alert that you've had a fall and where you are. Also add a list of your current medications. It's important for your doctor to know what you are currently taking so they know to avoid any medication interactions. Depending on your state of mind, these are 2 things that may not be able to be communicated with the healthcare professionals. A good alternative to these 2 lists is the Vial of Life. This is a form that identifies all of these areas and more, like current medical conditions, allergies, your doctor's name and phone number, insurance information, and many more areas. You can visit www.vialoflife.com and print this form to easily be ready in your go bag. Once completed, have this bag ready to go in an emergency by your door. Just like alerting your local fire department about access into the home, also let them know about your go bag in case of an emergency. Thank you so much for following along with me and grabbing your tools for your falls prevention toolkit. Again, please don't be scared about reaching out to your community on those resources to help you prevent falls. I hope you reach out to us and tell us what tools meant the most to you and what you're implementing in your life. I hope you've had a great Falls Prevention Week 2022. Thank you.